Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. And to follow up on the previous question, you've talked about plans to make sure that the uninsured will get treatment for COVID-19, but more than 300,000 Tennesseans were uninsured before this economic crisis, and that number is likely to go even higher with people losing their jobs.
Right.
Would you be inclined, or would you consider using your emergency powers to follow the lead of 38 other states and accept what Governor Haslam called free money from the federal government to do a full Medicaid expansion so that no Tennessean will have to worry about health insurance after this?
Yeah, what we're focused on right now, Phil, is the effects of COVID-19. Those are the policy decisions that we're making, and we're committed to finding a way to make sure that every Tennessean is served in their health needs for COVID-19. Those are the decisions that we're making right now, and we're not considering additional decisions around that.
So what would you say to those Tennesseans who've lost their jobs and are now not going to have health insurance when this is over?
I would say
not just for COVID-19, but for everything.
Yeah, I would say that we're going to do everything we can to provide relief to folks who have lost their job. We're doing so with unemployment benefits. We're waiting for guidance from federal government and for the actual dollars from the federal government. We're also looking to provide relief for small businesses so they can get started back up when the time is right in our state, so folks can go back to work. We actually really believe that once we get through the health crisis, then the economic impacts will begin to improve, jobs will open back up, people will become employed, and we can start back to an economic recovery that will provide relief to many that find themselves unemployed today. We certainly hope that they will not be unemployed in the future.
So for those who do not get jobs immediately, why not give them full Medicaid coverage?
Well, we are focused, as you know, on the effects, and as I've said, on the effects of COVID-19 right now. It's an enormous challenge for our state. We're addressing it economically, and from a health standpoint, those are the things we need to be focused on right now. That is the crisis that Tennesseans are facing, and those are the decisions that we're making today.